Welcome back to Spotlight. I want to say good evening to Ms. Noeline Levens-Clark. Good to have you.
Thank you. Good to be here as well.
Yes. A lot going on.
Yes.
You got a report,
Yes.
2013 report. You did a lot. Let's start at the beginning,
Okay.
the statistics.
Okay.
What was happening over the years, we reducing the rate of infection, and, that kind of stuff.
Right. Well, like I reported in previous shows that we did, in previous years up until 2008, 2007 we had 67 new cases, and then in 2008 we had 9 new cases, 2009 9 new cases, 2010 7, 2011 6, 2012 5, and then last year 2013 we had 10 new cases.
Well, that's interesting.
It is interesting. We are supposed to, as a Caribbean nation and as a member of world countries, report on the achievement of Millennium Development Goal number 6, where the BVI must demonstrate a lessening in the new cases of new infections. So, to be honest with you, we don't see going up to 10 as an increase or that the BVI HIV incidence is on the rise. We related to the fact that we are testing more. We have increased access to HIV testing, and so persons who are already infected now know their status.
Okay, so it's more knowledge.
It's more becoming aware.
Not that the rate is going up.
Exactly.
Okay.
And if you look at it, we have never gone beyond 10.
Do you have any indication that the rate is coming down?
Do we have any indication that the rate is coming down?
Yes.
Not yet.
Okay.
Not yet.
Because it seemed like the rate was coming down.
It seems so,
right?
based on the numbers.
9,
and then we flipped
7, 6, and then 10. I was like, what?
Yes.
What's happening there?
Yes.
Okay, so, but we still holding.
We're still holding our, yes, we're not going past a certain amount.
Yes. A certain amount. Now, how about the management of the disease? People more comfortable, they living longer, access to medication, how are those things?
Well, HIV is classed as a chronic communicable disease, and so this is because of the introduction of antiretroviral medications, which are working. They're not as expensive as they were probably 10, 20 years ago. More people are able to access them. Every person in the BVI that we know of that is accessing care and treatment in the BVI has access to medications. They can get their medications, it's affordable. They have assistance from the HIV/AIDS Foundation, and they can take it and live well, they can live long. So AIDS is no longer a death sentence. It's no longer a reason to die.
So how are we managing in terms of people being afraid, the stigma,
To be honest with you, what we plan to do this year is to do an assessment. We want to do a survey among persons living with HIV to assess the level of stigma and discrimination. I personally have seen a decrease. I believe more people are more aware. We have a lot of young persons who are born into a generation or an age where HIV has been around, and so they're more conscious, they're more accepting. We have over 40 volunteers who work with us, and whenever someone comes into the territory, when we bring in someone living with HIV, it's not a big deal. They let the person feel loved, let them feel comfortable. It's not that serious.
So people are no longer shying away and like not shaking your hand. The knowledge, you think the knowledge is going out that the ways that you contract HIV is not by just looking at somebody or just touching them, and we have begun to understand the virus.
Yes, well, it's not as bad as before. I know in the past it has been reported that there have been some persons who have been evicted from their apartments, lost their jobs, even been deported from the BVI because of assumption or knowledge of their HIV status. I think our political leadership has put things in place where our labor code, 2007 labor code, states no one can be denied a job or have their job terminated because of their HIV status. Our constitution also protects the rights of persons living with HIV, and so persons can live and work in the BVI, and they have legal recourse if they experience direct stigma or discrimination from anybody else. There are a few persons in our population who are still not comfortable, who are still afraid, who may still have hang-ups and behave not accepting. But at the end of the day, I think the majority of
Generally
persons,
speaking,
yes,
the stigma is diminished.
yes.
Okay. And people coming into the territory still have to go through the testing process, and we know when they come in whether they are positive or negative?
No, the BVI actually implemented HIV testing for immigrants in the past, and the Ministry of Health had to terminate that because we were blacklisted. We were violating individuals' human rights. What we're doing now is asking the health sector, we met with the CEO, and asked the health sector to offer HIV testing to everyone, whether they're coming in, whether they're living here, wherever. Anyone who sits in front of a doctor, nurse, any healthcare provider, offer an HIV test, so that we scale up access to HIV testing and persons can know their status.
Okay.
Yes.
Now, how are young people faring? We have any separate statistics for our young people? I see that you feel the need for an intervention in the high school. What is the data on our young people in terms of rates of infection, management, stigma, and so on?
The data that we have, there is no HIV affecting any young persons that we know of in the BVI. None that has been reported so far.
And when you say young person, you're talking about under the age of 18?
20. Let's say 20.
Less than 20? Okay.
25.
Okay.
Yes. We do know that there are statistics that show some levels of sexually transmitted infections. Syphilis, gonorrhea, herpes. Herpes is very common. It's much more common than HIV among young persons. And so we are still targeting young persons, educating them on the importance of safe sex practices, use of condoms, use of contraceptives to avoid teenage pregnancy and all of that, just so that we can increase their sexual health.
Okay, so, all right. And funding, I know that the funding is decreasing. So how are we going to keep up with all the needs of education, medication, management, general social support and those kinds of things?
That's an excellent question. The BVI government is committed to eradicating HIV, and unlike other Caribbean governments, even some of our other British overseas territories, funding is provided by the BVI government to the National AIDS Program to do what needs to be done to scale up programming. We also have funding of 6 million euros over the last 5 years from the European Union. PAHO, Pan American Health Organization, is managing that money. The 6 million euros is being spread out among 11 overseas Caribbean territories, both British and Dutch. And we have had to create strategic objectives, what we want to achieve, and report back to the EU on what has been accomplished. This year, 2014, is actually our last year for that 6 million euros to be spent. Whatever is left over of that. Most of us have probably about $67,000 to $100,000 left. And I know that the EU has committed an additional 1 million euros to just ensure sustainability of certain programs when the 6 million euros and this project has ended this year.
And how far along are you on achieving your goals?
Well, I don't want to brag or boast, but PAHO has shared that BVI is way ahead of most of the other OCTs. We have done a lot. We, I believe, need to now assess or evaluate the impact. Yes, we've had a lot of activities. We can see some amount of achievement. We have more persons testing, more persons knowing their status, more persons using condoms. But what we want to do this year is a knowledge, attitude, personality and behavior survey, a KAPB survey, to assess sexual practices, unsafe, safe sexual practices among our population. So we can, but we don't want to do that until we start media campaigns, pushing it via billboards, commercials, that kind of thing, and then probably 6 months later, assessing the impact to see how much we have achieved.
Okay. You said you got an increase in testing.
Yes.
And you have an increase in testing among young people?
We have an increase in testing among young persons. We have an increase in testing among men. We have an increase in testing among sex workers, women who work in the sex industry, dancing, clubs, that kind of thing. And just the general community on a whole. We're having a lot of first-time testers, which I'm so proud of. I'm very glad about. Persons who come in and get tested, they go back and they tell their friends, they tell their families, and they are coming in. We're having every year, we test between 300 to 400 persons alone at the National AIDS Program.
Okay. Now you have a foundation, and I can't remember, the name escaped me.
The HIV/AIDS Foundation?
No, the new...
Vivian New Day Foundation.
Vivian New Day Foundation.
It's a New Day, yes.
Yes. Talk to us a little about that and the success that that's having.
The Vivian New Day Foundation is the support group for persons living with HIV, persons who are infected with HIV, as well as persons who are affected. So even their family members. We have women whose husbands have HIV, they may not. We have women whose children or child may have HIV, somebody's brother or sister. They are a part of the group. It started in 2008 with Dr. McAnany, and it kind of became dormant. And then when I came on board in 2010, started it again. We now have between 24 to 25 persons in the group. It's a very vibrant group. It's a very active group. The good thing about the group is that everyone has a story to share about HIV, and so they're all in the same boat. Mm-hmm. So that level of confidentiality is there, that level of acceptance. You can come in being HIV positive and just let down your hair. Just be yourself. You don't have to pretend. You don't have to put on. The group has been meeting since 2010, and every year they set their annual work calendar. We send it to PAHO. PAHO finances some of their activities. They bring in guest speakers every other month or so to speak to them on medication, nutrition, sexuality, whatever it takes about living well with HIV. They travel. They attend conferences with us. They guide the National AIDS program in some of the decisions that we make, some of the activities that we plan. They're the ones that say, Clark, don't try that, or you're doing a great job, we like this idea, why don't you try this? It's an excellent group. I love working with them. It's awesome.
Yeah. How are families with HIV positive persons managing? How they dealing with a person living with HIV?
To be honest with you, I think being a nurse for 25 years, this is my 25th year being a nurse, I have seen a marked improvement. I remember in the late 80s, early 90s, when you were told that you had HIV, first thing you had to do was tell your family and prepare for death. And that was very traumatic, especially on persons who were breadwinners. They were the main source of income for the family. Now, because persons are living longer, some persons, knowing their family, prefer not to share their status. They can manage on their own. They can get the support they need. If they don't want to come to the support group, they can call in and talk to someone in the group, one person that they trust, that kind of thing. Or they just find other means of coping. And so persons are no longer dying. Persons are no longer developing AIDS like before.
Right.
And so the impact on families, the impact on individuals is not as bad as before.
What about husband and wives, where one has contracted HIV and the other one has not? You have any idea how those types of families are surviving? And
that is called serodiscordant couple, a couple where one is positive and one is not, and that's the most stressful situation I've ever seen. It brings to light fear from the uninfected partner of just having basic sexual relations, and it is actually quite understood. Many partners love their partner regardless. They have committed to stay with them. It's our secret, it's our challenge. We're going to fight it together. But I know it has brought about a lot of other issues in relationships that
infidelity issues.
Not necessarily infidelity, just depression, sexless marriage where there's just no sexual relations. We encourage the use of condoms, but not all persons are comfortable using a condom. Some are, and they're fine, they're comfortable. Because if someone's HIV viral load is controlled, like Magic Johnson, where it's below 50, below 20, even if the condom bursts, it's highly unlikely that they'd be able to pass on the infection. So we push control in the person who is infected, and then also encourage use of condoms whenever they're having sex.
Okay. I want to move on to the strategic plan.
Yes.
We got to take a break. Is there anything else you want to report on that I didn't ask?
Not necessarily. I think you covered most of it.
Covered most of it.
Yes.
Okay, we're going to take a break for a word from our sponsors, and we're going to come back with Ms. Levens Clark and talk about the strategy going forward for HIV AIDS 2014 to 2018 here in the BVI. Keep it locked right there, the Spotlight. We'll be right back.
Spotlight is brought to you by Tortola Concrete Limited, Clarence Thomas Limited, and H. Labadee Stout Community College.
Welcome back to Spotlight. I'm here with Noeline Levens-Clark, the National AIDS Program Coordinator, and we're having an interesting report on HIV/AIDS for 2013. A lot has been done, a lot has been accomplished. Seems like people managing HIV very well. It's now been, I guess you could say, downgraded to a communicable chronic disease. And I personally was hoping to have it included in the chronic disease programs, program. So instead of saying the national program for national strategy for the prevention and control of non-communicable diseases, I was hoping to have it say the national strategy for the prevention and control of chronic diseases.
Yes.
Take out the non-communicable
Yes.
and include HIV in that whole package.
It is included to some extent, but because it's communicable, it cannot be classed with non-communicable.
Yeah. I see that.
Yes,
you know,
they're all
I see
chronic.
that.
Diabetes, high blood pressure, HIV,
Yeah.
basically, yes.
Chronic disease. Yeah. So you got your final draft of your national strategic plan for HIV/AIDS. Well, what is that? What is the national strategic plan?
Okay, before this document, what we did as a national AIDS program was to assess where we were as a country when it came to our response to HIV. Churches, faith-based organizations, the government, non-governmental organizations, individuals, tourism sector, health sector, where were we? And that was our situation analysis. After that, we decided to come up with a plan, a roadmap, a way forward. Where do we want to be and how we were going to get there? And that is what the NSP, the National Strategic Plan, is all about.
Where you want to be?
Where we want to be by 2018 when it comes to HIV programming. The funding is coming to an end. We have one more year to establish systems in this country, ensure that we have whatever we need to deal with HIV as the BVI on our own without having to depend on funding, help, crisis management from anywhere else.
So we want to completely control it
Yes.
from within.
From within.
And have all the support we need from within.
From within.
And be independent, self-sustainable.
Yes,
In
that's the word.
in the prevention and the control of HIV.
HIV, yes.
What is the plan?
The National Strategic Plan is an awesome document. It is a multi-sectoral approach where we have the tourism sector, the construction sector, the health sector, media, different components of our society coming together and saying, this is what we can do. This is what we're going to do. It's a 5-year plan. It begins this year. But if you look at it, if anyone can get a copy of it, if you look into it, we have already started some of the activities. The health sector work plan is almost implemented, basically. The health sector has been trained in provider-initiated testing and counseling, and so when they offer, they are increasing prevention by persons knowing their HIV status. If you test negative, you want to avoid becoming infected. If you test positive, you get the care and treatment you need, and so you prevent infecting someone else. You prevent developing AIDS. We also have a component for the media campaigns, how we're going to go about that, tourism sector, that kind of thing. It's an awesome document, like I said, and key recommendations we plan to fulfill by the end.
In a 4-year period.
Within that period.
Okay, so right now you have the work plan drawn up, right? And so what's going to be? So what has you mentioned what has been implemented?
Some of the activities have been implemented. We already did the provider-initiated testing and counseling training for the health sector.
Okay.
We started the Let's Talk About Sex show. That went into a break.
Is that coming back on again?
We are planning to bring it back on again. Yes, this year. We have done a lot of work with our school-age population. We have done a lot of work with our commercial sex workers. Our drug users, not much work, and so we hope to do much with that in the next coming years. Those are our at-risk populations. Married couples, singles,
What you
women.
going to do with married couples?
We plan this year to implement a program called Marriage Builders. It is obvious that a lot of marriages are not working out. Those that don't end in divorce are just going through the motions. They're together. There's no happy sex life. Couples are cheating. Some couples are married but still have their side thing, that kind of thing, and it goes against the British Virgin Islands core values, what we believe as a society. It seems as if anything goes right now, and we're trying to strengthen marriages. A lot of churches are doing great work when it comes to marriages within their congregations, but there are marriages that probably do not attend church. Or probably, yes, and so we need to find a way to strengthen them. Or young men, out of school young men, in school young men, they're at risk. Those that are in school are dropping out, probably getting caught up in crime, drug use. Crack cocaine, marijuana, and alcohol are the 3 drugs that are being used most often in the territory by young people. And it compromises their ability to say no. It pushes them to have unsafe sex just so that they can get money to pay for the drugs, and so it puts them at risk. And these are populations that we really, really need to target by the end of this year and ensure that we prevent the spread of HIV.
And what's your strategy for that, for addressing that particular issue? What you're focusing on?
It's going to be very difficult, but we're working with the Sandy Lane Center and other agencies. They are involved in the National Strategic Plan as well. Next week Wednesday, we have an operational planning meeting where each sector will decide what they can do to target certain populations, and the Sandy Lane Center is involved as well.
Is social marketing being considered?
Social marketing is being considered. We are launching a Facebook page very soon. We have a website that is dedicated to persons living with HIV, and we hope to link it to our local news sites, online news sites, so that persons who are curious, who are doing research, who want to know more about HIV and other STIs, sexually transmitted infections, who want to ask someone with HIV a question, who want to read about someone's experience, they can log on to the website and get as much information as they need.
Okay, and that's one component of the strategy.
That is just a small component of the strategy.
And what else you're planning to do?
You're asking me like you weren't even a part of the process. We plan to assess the level of stigma and discrimination among persons living with HIV. We do know that there is a high level of self-stigma where persons have just this fear, this incomprehensible fear of even sharing their status with anyone because they're afraid. And sometimes it's not just based off of irrational beliefs. You can listen to sometimes your coworkers, your family members, see how they think and what they say about someone HIV, and then you decide, oh hell no, I'm not going to let them know. And we need to assess where persons are right now and then see how much we can address that issue. We do need a help desk. We do need human rights programming. We need to strengthen that. The BVI government has our human rights. That's right. Yes, Mr. Elton Georges.
There's a complaints commissioner.
Complaints commissioner, but persons in the private sector, the only place they can go basically is to labor, to their pastor.
But they could still go to the complaints commissioner.
You sure?
Yeah, but I mean, the thing is whether you would want to go to the complaints commissioner on an issue like HIV or discrimination in the workplace.
Most persons, if they experience it, they just let it go.
Yeah.
We do advocate for persons to go see a lawyer and prosecute, but many persons are afraid because they're so afraid of their status being made public. We can request closed court, but not many persons want to go through the hassle.
Yeah. Now, I'm getting the sense that there is there's the open fear, the manifesting fear is not there, but there's an underlying fear. I might appear accepting,
yes,
but in the back of my mind, I still got some reservations.
And you hold a distance.
Do you get that sense?
It's possible. I'm sure it does exist.
Are you going to be assessing for that sense?
We're going to assess for that. And we have had 1 or 2 instances recently where persons have been actually had incidences of discrimination on their workplace. But like I say, most people decide, just let it go.
Okay. And at the end of the 4-year period, go over again what vision should be fulfilled.
We should have an enabling environment where persons living with HIV are comfortable in living, working, and being in the BVI without fear of rejection, without fear of discrimination. They can feel free to share their status, and it's not a big deal because it is a chronic illness. We also want to have integrated care and treatment where persons can feel comfortable going to any doctor because the doctors and nurses and healthcare providers are on par with international standards when it comes to HIV care and treatment.
And the confidentiality.
Confidentiality is respected, and there is recourse if it is not. We want to ensure that our HIV statistics go down. We want to see no babies being born with HIV, hardly any new infections. If we probably have one, it's probably 1 or 2 this year. We're holding our breath because so far, for 2014, we've had no reported cases, and I would love to see the day when persons are no longer contracting HIV. It's going to take a while though, because like I say, there are persons who are already infected but still don't know their status.
And we need to know everybody's status.
Everyone needs to know their status.
Everybody needs to know their status.
Yes.
Yeah, but well, okay. Now, you don't think that we'll be moving towards mandatory testing?
No, that I know based on discussion. I've been advocating for it, but our chief medical officer is totally against it. It is a violation of persons' human rights. You should not make certain things mandatory.
Okay, that was my next question.
Right, the BVI epidemic is not as bad as some places like the Bahamas, where they have a 3.1 incidence, Jamaica, Trinidad. And I do believe that we don't think it's a major problem. But I still think that we need to stay on the alert, because criminal, it will creep upon us. And if it starts to affect our working age population like it has affected other countries, we will begin to see our tourism sector wiped out, our construction sector, our media, our health sector, and we're going to be in a bind. So we have to be very careful not to get too complacent, not to get too comfortable.
Great. We're going to take a break again.
Sure.
And when we come back, we're going to talk about the activities coming up. We have a bunch of activities coming up empowering young people. We're going to talk about that when we come back after this word from our sponsors. Don't go away.
Spotlight is brought to you by Tortola Concrete Limited, Clarence Thomas Limited, and H. Labadee South Community College.
Welcome back to Spotlight, and I'm enjoying my conversation. Yeah, it's not a conversation to be enjoyed, but we are really getting out some good information here from Miss Clark Levens, Miss Levens Clark, a national coordinator, National AIDS Program Coordinator. And we had a report on HIV/AIDS for 2013. We have a strategic plan 2014 to 2018, which is a 5-year plan. I need to correct myself on that. And now we have some events coming up for Valentine's Day. We need to talk some about that. Love yourself enough to live. That's your theme.
Yes.
Love yourself enough to live. And it's a 1-day sexual and reproduction health intervention targeted at secondary school children. Now, first question is, love yourself enough to live. That theme, how does that come about, and what does that signify?
Given the fact that Valentine's Day is the day of love, the week is the week of love, February, yeah.
Yes.
We decided to, in the past we've had open house. Few people would come, but not many, to see what the National AIDS Program is doing. We would launch posters. I think we've come to the end of that journey. And we decided to, after collaborating with the Somebody's Child Foundation, and that foundation is led by Minister Robert Stormwright, who works very actively with the support group. He works with the National AIDS Program. I met a young lady in St. Vincent and the Grenadines 5 years ago, and that young lady impacted me. She's been living with HIV for over 10 years. She not just has a story to tell, she is, when I tell you, powerful. She will, trust me, she will change the way you think about HIV. She's confident, she's beautiful, she's sexy, and she lets you see things in a different light. Very knowledgeable. So she's going to come into the territory tomorrow. She's arriving tomorrow along with her partner, who is a communication specialist in HIV and also a human rights advocate. And we have 4 days of activities planned. It's not just one, it's 4.
Oh, okay.
So given Thursday, we hit the ground running from 9 to 1:30 with a session for the clergy. We have invited leaders of faith-based organizations, pastors, deacons, youth leaders, etc., to come and sit and let's just decide on the way forward when it comes to the community of faith and sexuality, sexual health, reproductive health, HIV.
And that's going to happen where?
That will happen at the Methodist Church Hall on Main Street from 9 to 1:30 on Thursday morning, this Thursday.
This Thursday.
Yes, February 13th.
Yes.
And then we head to the Road Town Police Station to meet with our uniformed men Our police officers, Odinga will speak. She will present, Mrs. Odinga Luiwana, she will present her story. We will also share some more on HIV. And then we move on to country associations at 5 o'clock in the afternoon on Thursday at the Training Division Conference Room. We want to show persons who are living in the BVI from different countries how vulnerable of a population they are. Given the fact that they enter our territory to come and work, they will develop relationships. And there are persons coming in not knowing their status. There are also persons coming in who are getting involved with persons and have no knowledge of their status. And so there is a mix that is very potent and it's a good breeding ground. It's a dangerous breeding ground for HIV, and we have seen it over and over and over. Trust me, Cromwell, when we get one report, it's not just one person that is infected. We have to find out all who they slept with within a given time period, then assess all who those people slept with, and it's just a continuous cycle of contact tracing. And so it's very tiring. Yes. Sometimes we get names from back in their home country, and then we have to call the health center or the Ministry of Health to follow up.
It's a major event.
It's a major event. It's a serious event.
Yeah.
Either the person knew they were infected, but preferred not to share it, or did not know.
You don't want to have to go through that process.
No.
You prefer that people know their status and people practice safe sex.
Regardless, whether they're from the BVI or from abroad, know your HIV status. After we finish with country associations, the support group is having a barbecue to welcome her and to share with her what we're doing at 7 o'clock that evening, Thursday evening. We wanted to have every single secondary school visited on Friday, Valentine's Day, but we were so disappointed on Friday when we learned that this Friday would be midterm break for public schools. And so we're only going to be able to meet with St. George's Secondary and the BVI Seventh-day Adventist School. We are going to try, however, to get to Virgin Gorda on Wednesday, if that is possible, and see if we can include Cedar School as well, whichever day it can work for them.
Now, what make you feel that you need to go to the young people? You got data that's saying that there's some challenges there. Young people have never. I don't know if you have been told. When I was growing up, I've never been told about sexual and reproductive health. Right. So we don't get that kind of information. Right. Is that your assessment?
That's not the same with this generation. The Youth Health and Sexuality Survey that was done in 2012 by the Ministry of Health and the Pan American Health Organization showed that our young people are very knowledgeable. They know. It's just translating their knowledge into action is where the challenge begins.
And so you're hoping to motivate them?
We're hoping, and I'm seeing a difference. Trust me, Cromwell, the amount of young people that come in for HIV testing and send their boyfriend or girlfriend for testing, the amount of young persons that are waiting to have sex is still high. Only about 37% of young people are actually sexually active.
Only
37%. We have 63% of our young people who are not active, and we try and highlight them, those that are sexually active, by saying, "Oh, everybody gone well," but not necessarily so. No.
Okay, that's it. That's interesting.
Yes.
So, and you're having a prayer breakfast?
We're having a prayer breakfast Saturday morning. It starts at 6:30 at the Upper Room Victory Church Hall. We are hoping to have at least 70 persons. We're going to have good BVI breakfast, bush to the works, and Mrs. Luiwana will share with any person who has purchased a ticket for only $10. They can come to the National AIDS Program and pick up their ticket, or if they want to give a donation just to support the cause, we're going to have that. And then Sunday, we're going to do a church service at the Church of God of Prophecy.
Okay.
In Hope Hill, I believe, in the evening.
Okay. So there's one paying event.
One paid event, and that's a prayer breakfast.
And that's a prayer
breakfast.
That's
just to defray the cost of the food. It's nothing for a profit or anything.
Right. And the tickets are on sale at the
National AIDS Program, yes.
In the Betito Fed building.
That's correct, on the second floor above Little Switzerland Jewelry Store.
Okay, cool. So I think we've covered, and it's a shame that you're only going to get to a couple of the high school.
Yes. I was disappointed. I was really
because you really wanted to get to Elmore South.
All.
You want to get to all of them.
Yes.
Yeah. Now we got a couple of minutes left. The faith-based organizations, are they showing more or greater spirit of cooperation? I seem to feel like we've been having some challenges with the faith-based organizations, the churches and so on. Is that your assessment as well?
I am aware that when Dr. McInerney was National AIDS Program Coordinator, he did do some work with pastors and leaders. Since I've come on board, it seems as if every activity that we've invited the faith-based organizations to, we've had very poor attendance. I don't know if Dr. McAnally did such a wonderful job that they are just keeping that down pack, or if they're really not interested. But we're going to find out. We are going to find out this week because we sent personal invitations. We're going to see how interested churches and their leaders and members are.
Have you spoken to the pastors?
We called to follow up and find out if they're coming, but we haven't.
Yeah. Because we still get in the sense that the church is saying that this is a punishment by God.
One, they also don't believe in safe sex, using condoms. So we have been invited by some churches to do presentations, but there's some topics that they prefer not to cover.
They are more focused on abstinence.
Abstinence. You wait on God, you get married, and then consummate your marriage.
Okay. But
The reality is that's not happening. That is not happening. A lot of persons who attend faith-based organizations believe in God, they love God, they trust God, but one of their
they
biggest...
also love sex.
You said it. You said it. That's the truth. That is the truth. Not just necessarily that they love sex, but they have sexual challenges.
Well, they have relationships.
They have relationships. They have sexual relations.
And it's difficult when you have a relationship, especially if it's a loving relationship,
Yes.
to deny yourself the pleasure of that relationship.
Yes.
It's just the human nature, the human
And
condition.
one thing we fail to tell people when we're talking about sex is that sex feels good for some of us. And so we have to find other ways to, tap into that. Yes, the Bible is there. Yes, people try. But at the end of the day, people do have challenges. Some people fail.
And so the churches are failing to deal with the reality.
Are they failing to deal with the reality?
Because
some
the
extent.
ideal, they're trying to manifest the ideal, and that's fine.
Yes.
We want that core value.
Yes.
But you neglecting the reality.
The reality is this is what the situation is.
Is something different.
Yes.
I don't know. You could even say they're disobeying Jesus by neglecting the reality. Because when Jesus said you go into the highways and the byways and you go among the drunkards and you try to save them, this would be a similar situation, wouldn't it be?
Yeah, but sexuality has always been a taboo topic, especially among churches. We don't want to speak about homosexuality. We don't want to speak about bisexuality. We don't want to speak about sex. Different ways of having sex. There are a lot of Christians who are having sexless marriages. There are a lot of Christians who are also engaging in infidelity and that kind of thing. And it's not because they don't love God, Cromwell. I'm telling you, I know I could see people's passion. It's just that it is a challenge, a spiritual challenge. No, I remember hearing you say that based on where you are in your spiritual walk, certain things will be a challenge for you. The Bible say, love not the flesh. If you cater to the flesh, there is death. If you cater to the spirit, there is life. And so if you, hold on yourself and just trust in God, He's going to see you through.
Well, today,
which is the truth.
But yet, and also where you are on your spiritual journey, you will be able to resist easier.
That's it.
Yeah.
That's it.
Yeah.
That
So,
is it.
all those things, and I think, and I'm disappointed to hear that the church is not dealing with the reality in that way. But, everybody come along eventually.
Hopefully.
Yeah.
Yes.
We're on the eternal clock.
I know.
But it's always, it's really always a pleasure to have you.
It's a pleasure to be here, too.
Yeah.
I'm really grateful to you.
Yeah, and so anytime, you could just call me up and don't be afraid to say, listen, I want to come. I'll fix it up.
Okay, then.
All right, so all the best and congratulations on a wonderful job that you're doing for the community.
Thank you. Still can't do it without everybody else.
Yes. Well, Spotlight, of course, is seen every Tuesday at 8 p.m. here on JTV Channel 55 and broadcast Sundays at 2:30 p.m. You can check us out on jtvlive.net if you miss any other programs. You missed this program, you could catch up in between. Also, thank you for watching. Thank you for email me at jtvlive. No, hold it. Email me at jtvspotlight@yahoo.com. I'm having a senior moment. And I thank you very much for watching, for your words of encouragement and your suggestions. I'm Ed Joenka reminding you that when the spotlight is on, you see the facts. Peace and blessings.
Spotlight is brought to you by the National Bank of the Virgin Islands, the BVI Tourist Board, and CCT Global Communications.